Hi everyone, welcome back to Boncho Club. Today is February 5th, and I'll go over some up-to-date medical news for you today. The first one we have here is alternative therapies go mainstream. So this is a really exciting news for us acupuncturists and herbalists. More than one-third of American adults now supplement or substitute mainstream medical care with treatments long considered alternative. In 2022, 37% of adult pain patients used non-traditional medical care, a marked rise from 19% in 2002. This is usually for pain management. The use of yoga to manage pain rose to 29% in 2022, up from 11% in 2002. Uh, This article states this is the New York Times, by the way, and the article will be on the description below. It's in the public domain so much, and people hear acupuncture, meditation, yoga, and they start to learn. According to the NIH, analysis reveals to significant rise in use of complementary health approaches, especially for pain management. So this is another NIH article that reiterates this. The use of yoga increased from 5% in 2002 to nearly 15.8% in 2022. Meditation became the most used approach in 2022, with an increase from 7.5% from 2002 to 17.3% in 2022. For acupuncture, thanks to the coverage of insurance, we saw an increase from 1% in 2002 to 2.2% in 2022. So that's almost double, more than double within 20 years within the United States that acupuncture is in use now. So that's very, very good news. I think 20 years from now, that number is going to increase even more. So being in this, the acupuncture field is a very, very um, good idea, I think, to be in right now. Okay, the next article we have is first functional human brain tissue produced through 3D printing. So, this kind of technological advancements are occurring at a rapid rate, even with AI and 3D printing. So, those two things are going to be very, very big issues, big topics that I think the future medical industry is going to be having to deal with. And to see that we already have a functional human brain tissue produced through 3D printing is exciting and yet alarming news because it means that we're already at the precipice of having um, that sci-fi futuristic medical time period in human history. So it's something that I think as medical practitioners we should all un- seek to understand and know, so that we know how to deal with new patients or new um, environments where there's going to be patients with 3D printed skin, 3D printed brain cells, 3D printed organs. It's going to be a totally different environment like the Wild West. So I think it's very, very crucial for us health practitioners to know what kind of technological advancements there are in the medical industry. So, according to experts at the University of Wisconsin-Madison, printed tissue can grow and function like typical brain tissue. This 3D printed brain model might be useful in studying various neurological and neurodevelopmental problems. This could be a hugely powerful model to help us understand how brain cells and parts of the brain communicate with humans. Wow. Okay, the next article we have is cycling could reduce chances of prostate cancer by 35%. So, on a previous Punch Club video, we talked about how cancer has been on the rise, and um, one of the cancers that are on the most rise is prostate cancer. So, Knowing that cycling could reduce the chances of prostate cancer by 35% is a very good tool to have under your belt when you consult your patients. So this study, the Swedish School of Sport and Health Sciences, spanned the period from October 1982 to December 2019, and it involved a comprehensive analysis of data from 181,673 men. Ultimately, the study cohort comprised of 57,652 men. So this is a fairly large study with a long history of analysis. So it's safe to say that there is a correlation between reduced chances of prostate cancer and cycling. So having this kind of knowledge for your patient consultation will be very, very good to have. The next article we have is, can eating an entire orange, peel included, really help you poop? So in social media, there's a trend going on where influencers are talking about how eating a whole orange could help you poop, essentially. So for TCM, for us Eastern medicine practitioners, we already know why that could help, right? Because Chenpi is a very great herb for regulating qi and helping move things along within your bowel system, right? So being able to poop thanks to eating a whole orange is a very, very I guess like a common sense thing for us uh, Eastern medicine practitioners. According to this article, eating entire oranges with their peels topped with a heavy sprinkle of cinnamon and cayenne powder is part of this trend going on social media. And according to the viral video, they say that orange peels contain naringenin, flavonoid with a laxative effect. So that's good to know. And there's also spices. So the cayenne pepper and cinnamon also trigger the TRVP1 receptors located in your mouth and GI tract, which helps you um, have bowel movement. So that's another good thing to know as well. So that's all the articles we have for today. Hopefully, this helped you in attaining tidbits of medical information for your practice. And I'll keep you updated with other news in the next video. Thank you.